The Limpopo Department of Health has expressed concern over the high number of teenagers who gave birth on Christmas Day in the province. According to their stats, 31 teenage mothers welcomed newborn babies on the 25th of December in Limpopo. The youngest is a 13-year-old girl who gave birth at the Seshego Hospital. And this has since sparked worry about the scourge of teenage pregnancy in that particular province. SABC News reporter Dieketseng Mashego and video journalist Llewellyn Carstens caught up with Limpopo Health MEC Dieketseng Mashego at the neonatal ward at the Mankweng Hospital.
We are now at the Mankweng Hospital where 17 babies were born on a Christmas Day, and I can tell you that the number of babies across the province were born yesterday, and the MEC for Health, Dieketseng Mashego, was crisscrossing the province yesterday, congratulating those mothers who gave birth on a Christmas Day. What a special day indeed. But I want to speak to her about the number of babies who were born in this province yesterday. Mashego, thank you so much for joining us here on SABC News. Let's talk about the number of babies who were born on a Christmas Day in this province.
Thank you very much for having us here. Indeed, yesterday we had quite a number of babies that were born as we're busy visiting all our health facilities to ensure that we welcome our babies and also congratulate the mothers. I can say that as the province, we received 172 babies yesterday. And then out of the 172, we had 90 baby boys and 82 baby girls.
We also understand that you also have teenage mothers. How concerned are you as the province when teenagers continue to give birth to children?
We are very much concerned as a province because just yesterday, out of the 172, 31 of the babies were born by teenage mothers. So it is very much concerning, and we are calling upon everyone to say, as the Department of Health, yes, we are working together with other departments to ensure that we continue with our health talks, we continue to motivate and encourage our teenagers that indeed it is better to abstain up until you are in an older age. But also we are saying we've got our family plannings where you can go into any of our facilities where you can be assisted in terms of family planning. So we are also calling upon our parents as well to say, let us talk to our children, let us guide them, let us motivate them, and let us be the ones who are actually open enough to allow them to talk about their relationship so that we can be able to guide them properly. So we are very much concerned. And the biggest concern is that out of the 31, we have a 13-year-old who gave birth yesterday. So that one, we know that there's no consent when it comes to a child. A child cannot give a sexual consent. So we are very much worried about that, and we are saying we are going to look at this case very closely. We'll be working very closely with the police to ensure, and the family, to ensure that indeed we find out what happened to the baby and we ensure that we assist her. I refer to her as a baby because she gave birth and she's also a baby. So we need to ensure that she is safe while we investigate and find out what happened to her. And if indeed something wrong happened there, obviously there is, then we'll ensure that we work with the police, case be opened and the perpetrator be brought to justice.
In most cases, when we talk about the teenage mothers, you find that the fathers of these children are the elderly men. And how are you going to work perhaps close with the Department of Social Development to ensure that these perpetrators get to book?
Yes, indeed, we are going to work very close with the Department of Social Development to ensure that we keep our babies safe, but also to say we've got structures, we've got organizations where we've got men who are there. Now we are saying it's high time that even men, they stand up, they work together with us to talk to their fellow men to say, no, indeed, now we must stop with this abuse that we are doing, and we need the men who are saying not in our names to stand up across in the communities everywhere to say no, and when we see something that is wrong happening around us, we report it immediately so that it stops, because it will never stop if we wait up until the MEC or the mayor comes to the place and they discover it. But we are saying to all community members, if you see that there's a man who's taking advantage of young children around the community, report it. We are working with the police to ensure that when the matter is being reported, then it will be properly investigated so that we can have a case and those perpetrators can be taken away from our communities, can be taken away from our babies.
Well, MEC Mashego, thank you so much for joining us here on SABC News. That is the MEC for Health in Limpopo, saying that she is concerned, as much as we know that last year 50, teenage mothers gave birth on a Christmas day, and this is a decline from last year because this year only 31, teenage mothers gave birth on a Christmas day. But the department is very concerned to say that these people who are impregnating these young girls must be brought to book, and they must also face the full might of the law. But I can tell you that we will be monitoring that because the 13-year-old, gave birth at the Seshego Hospital, and we will be following up on that matter to understand that who is the father, who is responsible for this matter.